So I got this message from this mama that says, "Good morning, ma. My name is Bumi. I gave birth last month, but it was later discovered that my baby had multiple holes in the heart. She later and I want to ask, what can cause such? And can it be prevented during pregnancy?" First of all, mama, I am so sorry for your loss. It's never a good feeling for a woman to either lose her pregnancy or to lose a child that she has delivered. So all our hearts go out to you, and I'm deeply sorry for your loss. And so to answer your question, whether there are things that can be done to prevent birth defect, there are some things that can be done. Absolutely. There are some things within your control that you can do to prevent your baby from having birth defects. Number one, we keep on shouting, please take your folic acid. So many women refuse to take folic acid because they say they have fibroids and they don't want the fibroids to grow, and so they don't take folic acid. Please take your folic acid. And this is a thing, even before you get pregnant. If you know that you are of childbearing age and you are having unprotected intercourse, please take your folic acid, because there is a chance that you can get pregnant. It helps to prevent neural defects. So all those babies that you see, defects in the brain, defects in the spine, taking your folic acid at the recommended dose, at the right dose, regularly, consistently, helps to prevent neural tube defects. Number two, I've said it before, smoking. A lot of you would say, "Doctor, I don't smoke." Yes, you don't smoke, but you take in passive smoke. So somebody is smoking around you. You just smoked, but you smoked passively. So that indirect exposure to smoke can also put your baby at risk of developing birth defects. Please avoid smoking, whether actively or passively. Alcohol, you already know this. Please avoid alcohol when you are pregnant. Number four, maternal age. There's an increased tendency, there's an increased likelihood of having a baby with birth defect if you're a woman who is pregnant from age 35 and above. So what can you do? There are tests that you can do in the pregnancy to ensure that baby does not have birth defects. Genetics. Your genetics, if you have someone in your family that has history of birth defects, if you have someone in your family that had birth defects, there is a higher chance than the average person that you could have a baby with birth defects. So genetics are also important. Another one that a lot of women do not know, blood sugar. Did you hear me? Blood sugar. I am telling you factors that you can control. You may not be able to control your genetics, you may not be able to control your age, but you can control your folic acid intake. You can control exposure to alcohol. You can control exposure to cigarettes. You can control and do something about your blood sugar. From the minute that you are pregnant, make sure that you are tracking your blood sugar, because especially in first trimester, if you have a high blood sugar, if you have gestational diabetes, it is associated with a higher incidence of babies born with defects. And you don't want to carry your pregnancy to 9 months, and at the end of the day, you discovered that there were birth defects in the baby and the baby could not make it. Your journey will not go to waste. Your journey will not be in vain. Please check the things that you need to check and take them seriously, and God will keep you and keep your baby, and you will give us beautiful bouncing. God bless you. I love you.